So now we're going to talk about factors that are affecting capillary exchange. And that's where, again, the only place that exchange occurs is in the capillaries. And we're looking at a combination of diffusion. So remember, moving from high concentration to low concentration. Osmosis, moving mainly, we're going to talk about water, of moving high concentration to low concentration. And then filtration. Filtration is going to be kind of looking at based on blood pressure. So first we're going to talk about capillary hydrostatic pressure. That is synonymous with blood pressure. So it's the same thing. The amount of blood pressure in the capillary is considered the capillary hydrostatic pressure. This is what's going to help with filtration. So it's not dependent on high concentration or low concentration. It's literally just force pushing. So if you have more force against the vessel wall, so more things are pushing into it, then you're going to be able to push more out. So you can think of it as kind of if you're in a room and you have a large door and you have smaller people, well, they can slip out. And if there's kind of a lot of pressure where kind of they're smushed against the wall, well, they're going to kind of squirt into where the door is so that they can leave. So it's kind of the same thing. So you think of it as a big room. There's a lot of people in it. There's an intense amount of pressure. You're pushed against the wall. You have nowhere to go. You have nowhere to move. Well, if you're small and you can kind of just slide your way to the door and leave, you're going to be happier. So water and other small molecules like oxygen and other nutrients are going to leave the bloodstream. So they're going to leave the capillary and go into the interstitial fluid. Larger molecules like plasma proteins, and a major one is going to be the largest one of albumin, can't go through the door. They can't fit. So they are too large to fit through the door. Again, these are going to be capillaries without a lot of holes, so they can't move. They can't leave. So larger molecules, another thing that mainly is going to stay, like red blood cells are going to stay inside the capillaries, and they're remaining in blood. So larger molecules have to stay. Other smaller molecules can be pushed out and filtered out. But you also have the kind of driving force of high concentration to low concentration as well. So this is just showing you a better picture. So capillary hydrostatic pressure, again, is forcing against the wall of the blood vessels. So things like glucose that you want sugar to go to the cells can go through and go to the interstitial fluid. Amino acids can go through in the interstitial fluid. Ions can go in, water. But all these larger proteins can't fit through that hole. They're not fitting through that hole. All these other molecules can, but the larger proteins cannot. Again, diffusion we've learned about before. Again, it's moving substance from high concentration to low concentration. So I always say kind of moving especially if you're an introvert, if you're in a room with a lot of people and you have the opportunity to move to a room with a lot less people, then you're going to do so. And that's diffusion. Diffusion happens when the distance is short, meaning it's a lot faster. Again, it's faster and easier to run across the street versus if you're running a mile down the road. It's going to take you longer to run the mile than it is to run across the street. Kind of your desire to leave the room, again, kind of using that analogy with a bunch of introvert or a bunch of people and an introvert in the room, then the more people that's going to be in the room, the more you want to run out the door and leave. So it's the same thing. The more molecules or the higher concentration difference, where there's going to be 100 people in this room and only 5 people in this room. Well, it's going to be a large desire with a lot of people here to get to there. So it's going to happen faster. You're just going to run screaming. If the molecules are small, so if you only have kind of a small opening, small door to leave, well, it's going to be a lot faster if you're smaller to sneak through than if you kind of have to squish through the door and you're a little larger. This is happening all the time across capillary walls. Sometimes we can have, again, we'll have passive diffusion, facilitated diffusion is another one. So transport can be different based on substances, but diffusion is occurring. So looking at it, water, ions, small organic molecules like glucose, amino acids, urea is going to be a waste product actually, can enter. So urea is in this instance going to be more entering the capillaries. Glucose and amino acids are going to be leaving the capillaries. So they are going by diffusion. Again, high concentration to low concentration. So there's going to be a higher concentration of glucose in the blood vessels or in the capillaries. So they're going to leave. There's going to be a higher concentration of amino acids in the capillaries versus the interstitial fluid. They're going to leave. Urea is the opposite. There's going to be more urea because that's a waste product from metabolism. So it's going to be more in the interstitial fluid. So it's going to want to go back into the capillaries. So either it can go and slip between endothelial cells, or we're going to have fenestrated capillaries. So remember, continuous isn't going to have holes, but there is a little space or little alleyways between the endothelial cells that this can happen. Or if you have a fenestrated capillary, that's going to be where there's little pores, so more can move there. Ion, sodium, potassium, calcium, chloride are going to be major ones we've talked about before, and we'll talk about them some more. Chloride's going to be in the intestinal tract. They can diffuse through channels. So we're going to have facilitated diffusion here because there's going to be channels. So remember, this is you're going down the river. Simple diffusion is just you're swimming down the river. This is you're in a kayak. So you have some sort of kind of mechanism that you can go through to diffuse. Larger compounds that are water soluble, meaning that they dissolve in water, can't leave the bloodstream except if you have fenestrated. So those continuous capillaries, it's not happening. So fenestrated capillaries in the hypothalamus, kidneys, endocrine organs, because they're producing hormones and they want their hormones, which are larger proteins or some of them are larger proteins that need to get into the to the blood supply, and then the intestinal tract as well. Lipids like fatty acids and steroids and other lipid soluble materials like soluble gases, oxygen and carbon dioxide are actually fat soluble gases, can go through the endothelial cells. So what they can do is you have the endothelial cells of the blood vessels, they just go right on through. They diffuse through both plasma membranes and they can go through either in or out. Again, plasma proteins in most of the capillaries aren't passing the endothelial lining. They are too big. They are large and in charge. The only place they can change is sinusoids. So remember those specific capillaries that are flat that have larger holes in them, especially in the liver. Why is that important? Liver makes plasma proteins. That's where they're made. So plasma proteins need to enter the bloodstream here. So you need a way for them to enter and get in. They're produced. You need a way for them to go into circulation. So the opposing pressure, so we have capillary hydrostatic pressure, which is going to be the filtration pressure. So capillary hydrostatic pressure is pushing everything out. Well, capillaries need to push things out, but it also needs to pick up things. So it needs an opposing pressure. That opposing pressure is called blood colloid osmotic pressure. This is what we call sucking pressure, or pressure bringing back into the capillaries. And this is caused by plasma proteins. A lot of it's going to be albumin, those large plasma proteins. They are able to pull things, especially water, which is going to carry a lot of the water soluble contents from the interstitial fluid back into the capillaries. Why is this true? So you have a capillary and you have blood proteins that are going along. Well, here on the arterial side, you're losing a lot more water and objects. So there's going to be a higher concentration of proteins just because the water's been lost. Less water, then you're going to have a higher solute concentration or protein concentration because you've lost all your fluid. So there's not as much fluid for these to be floating in. So this is going to be a desire of water. Again, water's going from higher concentration to lower concentration. So water is going to want to go hang out with all these proteins that are still there. So it's going to bring more water back into the capillaries, which again is going to pull other things in. So as you're losing it, then it's going to come kind of the opposite is true. So that's the blood colloid osmotic pressure. Osmotic meaning kind of water pressure, and it's because of the plasma proteins that water's going to want to come back in. So makes sense at the arterial end of the capillary. What are the arteries bringing in, at least in systemic circulation? The arteries are bringing in oxygen and glucose, nutrients, all of those things to the capillary bed. So the beginning of the capillary bed, filtration predominates, meaning that you want to push out into the interstitial fluid. So what is the driving force of filtration? We just talked about a little bit ago. It's capillary hydrostatic pressure. And it's highest near the arteriole, meaning the beginning of the capillary bed. So this again, water, small solutes, all of that are leaving the capillary. As your filtration is increasing, I just talked about it, you're losing more water, so you're going to have more proteins, less water to float in. So then you're going to increase your blood colloid osmotic pressure, and this is going to be on the venous side. So venous side, arterial side. So as filtration is occurring, you're losing water, you're losing your solutes, then the plasma proteins can't leave, there's no holes for them. So there's less capillary hydrostatic pressure just because there's less kind of water pushing on the edges of the walls. And so then you get a higher blood colloid osmotic pressure. So when you're on the arterial side, the capillary hydrostatic pressure is higher than the blood colloid osmotic pressure. If that's occurring, then filtration's happening. Net filtration pressure. So how much is actually going to leave? Because there's still colloid osmotic pressure all the time. So if you have net filtration pressure, it's the amount of pressure that's pushing out versus the amount of pressure that's pushing back in the capillary. So look at this as a number. So if capillary hydrostatic pressure is 100 and blood colloid osmotic pressure is 50. Well, 100 minus 50 is going to be plus 50. That is going to show filtration. hydrostatic pressure is going to overcome the blood colloid osmotic pressure. And so things are going to net move out of the capillaries. As more fluid's leaving, your capillary hydrostatic pressure is decreasing. You have less water, so you have all those proteins wanting water to come back and hang out with them so they can float in. So your blood colloid osmotic pressure is going to increase. Again, this is going to be on the venous side. So you have a lot smaller capillary hydrostatic pressure and larger blood colloid osmotic pressure. So if you net filtration pressure, if you have a capillary hydrostatic pressure of 50 and you swapped numbers and blood colloid osmotic pressure is 100, then you're going to have negative 50. That is what we call reabsorption, meaning it's left the capillaries, but we're going to get fluid back in. So we're going to bring it back. Reabsorption is we had it, we got rid of it for a while, but we're going to bring it back in into the capillaries. So where does this switch? At about 2/3 of the way along the capillary, then there's going to be no movement because capillary hydrostatic pressure is decreased enough and the blood colloid osmotic pressure is increased to match it. So the net filtration pressure is 0 because these numbers are the same. If the capillary hydrostatic pressure is 50, the blood colloid osmotic pressure is 50, got a whole goose egg. So this is where it's going to switch. So again, the arterial side, you're going to have more capillary hydrostatic pressure, more filtration. Then all of a sudden around 2/3, you're at even. And then you're going to start going to where you're reabsorbing and taking back in. So it's just the switch is happening here. So again, venule side, reabsorption is predominating, meaning water's coming back in and the solutes are coming in. So capillary hydrostatic pressure is lower. So again, on the venous side, you have all these proteins. You don't have as much solutes and water pushing against the edge of the vessel of the capillary. So the capillary hydrostatic pressure is low, but all these molecules are saying, come here. All these proteins are saying that to water. So water is going to start coming back in. That desire is putting more pressure on the opposite side of the capillary wall. So you have opposite pressure pushing against it. Water's moving into the capillary. There is where this is in an even exchange. So more water actually leaves the bloodstream, so more filtration happens than reabsorption. So you're actually having more water out here than you actually can reabsorb. So not all the water can come back in. It's not 100%. And so that difference is about 3.6 liters a day. We're going to talk about this is important for the lymphatic vessels. So within the capillaries and the capillary beds, there's going to be lymphatic vessels within it as well. Lymphatic vessels are like the janitors. They're just going to clean up the mess. So what happens is the excess water is going to enter the lymphatic capillaries, go through the lymphatic system, and then go back into circulation because the lymphatic system dumps into the venous system, specifically subclavian veins. So we're going to talk about that more significantly when we talk about the lymphatic system. So just better picture than what you're seeing. So arterial side, so what's going to be highest on this side is going to be capillary hydrostatic pressure. Venule side, what's going to be highest on this side? Blood colloid osmotic pressure. So here you can see this is showing you the capillary hydrostatic pressure. This is showing you the blood colloid osmotic pressure. So this is much filtration of what's moving out into the interstitial fluid. And then this is what's moving back in, or pressure against the wall. So you have pressure out and pressure in. So think of it kind of more opposing pressure, kind of like arm wrestling. This day, the capillary hydrostatic pressure wins. So the net filtration pressure between 35 and 25, so 35 minus 25 is 10, and plus 10. So the capillary hydrostatic pressure is higher than the blood colloid osmotic pressure. So fluid is moving out. Here is when they equal. So there's no net movement. The capillary hydrostatic pressure is 25. The blood colloid osmotic pressure is 25. You have a stalemate. No one's winning here. Big old goose egg. So capillary hydrostatic pressure equals blood colloid osmotic pressure. No net movement. Now you're getting over to the blue team. So here you can see, again, the pressures decrease even here. So 35, it's gone to 25. Now it's down to 18 of the capillary hydrostatic pressure. Blood colloid osmotic pressure hasn't really changed that much, but the capillary hydrostatic pressure has decreased. So the desire for stuff to go back in is going to be the same, but there's less pressure against the vessel wall. So net filtration pressure is -7. Either way, this instance, the blood colloid osmotic pressure is higher than the capillary hydrostatic pressure. So fluid's moving back into the capillary. So blue team wins in the arm wrestling this day. So anything that is changing capillary exchange can affect the blood pressure. So if you have higher blood pressure in general, then you're going to have higher capillary hydrostatic pressure. Because remember, capillary hydrostatic pressure is the same as BP in the capillaries. You can actually have, again, changes on osmotic pressure of either the blood, or if you have more proteins and stuff in the interstitial fluid, that's going to affect the osmotic pressures. So any way that you're changing the capillary hydrostatic pressure and the osmotic pressure, then you're going to change capillary exchange. So a couple examples. If hemorrhaging, bleeding, is happening, both your blood volume is decreased and your blood pressure declines. If you bleed, all of a sudden your BP is going down. Why? Because you have less stuff pushing against the vessel walls, so you're going to have less pressure. This, if you're having lower BP, lower blood pressure, then your capillary hydrostatic pressure is going to be lower. So then you're going to have less kind of net filtration pressure. And that is going to actually increase the amount of capillary reabsorption, because again, if net filtration pressure is capillary hydrostatic minus blood colloid osmotic, well, if you're decreasing this number a little bit, not below this, but a little bit, sometimes you're going to have more kind of moving back into the blood. If you move it so significantly that it's lower than blood colloid osmotic pressure, then remember, if it's a negative number, then it's going to have reabsorption. So what's going to happen is you're going to take fluid, extra fluid from the interstitial fluid, and bring it back into the blood supply. Imagine this is actually a life-saving or important kind of mechanism. So if you are losing blood from bleeding Well, then you're going to take some volume, at least water volume, from your interstitial fluid and put it into your blood supply so you can kind of maintain your blood pressure. It doesn't get too low. If dehydration happens where you have less water, plasma volume is still going to decrease again because you have less water. This is losing everything. Hemorrhaging is losing cells and everything. Dehydration is going to occur. So the concentration of plasma proteins, that driving force of blood colloid osmotic pressure, like it talked about. So if you have more plasma proteins because you have less water, then the blood colloid osmotic pressure is going to increase. Water is going to want to go to this side. So there's going to be, again, different reasoning. Low blood pressure over here, increased plasma protein concentration over here. Same effect, though. Reabsorption. Because if you haven't changed as much the hydrostatic pressure, but you changed and increased the blood colloid osmotic pressure, then you're going to get more reabsorption. Another life-saving things, because then you can get more water recalled from your interstitial space. You're not drinking enough, so you can have more water come into your capillaries, and it'll increase your blood volume, your water blood volume. If capillary hydrostatic pressure rises or blood colloid osmotic pressure decreases, then you're going to have more filtration. This is going to be swelling. There's only so much your lymphatic system can drain out. If there's an increase where more water and stuff is leaving the blood vessel than being reabsorbed, then you're going to have fluid buildup in your tissues and your interstitial fluid. And so you're going to have a swelling, which is also called edema.